OpenNotes is a 12-month project funded by the Robert Wood Johnson Foundation. The OpenNotes project takes advantage of the fact that we all have a right to access our own medical records. The problem is that patients often have to jump through several hoops or pay sometimes non-trivial amounts of money to get copies. What we're doing in the OpenNotes project is giving patients access through a secure website to the notes that are already written about them by their physicians following a visit.
We wanted to get a real snapshot of different doctors and different kinds of patients. So this will involve more than 100 doctors in Boston, in rural Pennsylvania, and in a county hospital in Seattle, and as many as 25,000 of their patients. We're basically flicking a switch. We're inviting patients to read things that they generally have not been invited to read.
I would get involved with it if it was accessible to me, you know. I would definitely be involved with it, and the more I learn, the more I would want to learn, you know. The more I know, the more I would want to know.
People remember precious little of what goes on in the doctor's office. It's a high-stress situation for everyone, whether healthy or whether sick, and there's lots of data that shows that the memory for what happens in the doctor's office or the nurse clinician's office is not very good. So it'll be a reminder. It'll be something they can look at in the comfort of home.
We talk about so many different issues that sometimes when I get home I forget, and to be able to go back and get that information would be really valuable for me.
The point is, I would love to see those notes, to see really and truly what he's got there.
Society's becoming more transparent every day. We all know of businesses that talk about becoming more open to their customers and more transparent. Medicine is a little behind, but this is an important step, I think, in showing that transparency is important in healthcare as well as in the other areas of our lives.
Access is very, very critical to understanding exactly what's expected of me, what my doctor expects of me, so that when I come to the office, I'm ready to talk with her too. Not only does she remember, but I want to remember what's supposed to be happening.
We've had an opportunity to talk with patients in multiple parts of the country about their ideas about just the concept of OpenNotes. Most are interested, or at least intrigued by the idea, and are interested in looking at their notes. They're not necessarily sure what they'll find there. They're not necessarily sure that it will be helpful.
Patients worry about what their doctor will say about them. They bring up issues of trust.
Is a doctor kinder when he's talking to you in person and more harsh when he writes it down?
To add to that, is there any information that the doctor may receive that would be withheld from my viewing?
Doctors worry primarily about time.
My concern is that this will be the 1001 thing of the 1,000 things you got to do.
And it just shouldn't be any more work, because if it's more work, we have barely enough time to do the things we do now.
I'm hoping that the very act of having patients read their notes will have an effect on how patients and doctors interact.
Hopefully, this would be one avenue to draw patients in to become more engaged in managing their own health and well-being.
Yeah, I mean, I think anything to improve efficiency and knowledge for the patients would be good.
I think this may be a real step in transforming the patient and provider relation. There's lots of talk about shared decision-making. There's lots of talk about the level playing field. There's lots of talk about not talking down to those whom we serve. But the question is how to make it more than talk. And I think convening around a common instrument and eventually creating it together will go a long way to really making that change. And my own hypothesis is that will make for better health care and for healthier patients and a healthier citizenry.
Dr. Jacques Carter dictated a note on patient Joanne Aki. Joanne comes in today to follow up on her hyperlipidemia and her weight period. She has been making every attempt to.
I wonder if our behavior would really change because we know we're being watched. Right? I mean, would we try to be more perfect? And
I know mine.
Should we have been that way anyways?
We're asking a terribly simple question. After 1 year, should we leave the machine on? Should we keep the switch on go? Will the doctors want us to do that, and will the patients want us to do that? That's really the big question, and the answer to that is what we're all awaiting with quite a lot of curiosity. Our collective feeling, and there are many of us involved in this, is that this will be a real big step toward, in a way, a social revolution about the way healthcare goes. Those are grandiose words, but we're really trying to think about the big picture and move things along.